Thank you. No mai haere mai. Welcome to this webinar hosted by the LIANZA Hikuwai community called Philip Miles Toko Ingoa. I'm Philip Miles, the LIANZA Hikuwai counsellor and a facilitator for this session. So I'll just start us off with a karakia. Me karakia tātou. Manawa mai te Māori nuku, manawa mai te Māori rangi. O te Māori kaiau, he Māori tipua, ka pākuru mai te pō, au mai te Māori, Omi e, hui e, taiki e. Right, usual sort of webinar housekeeping, so please stay on mute unless you're speaking. We'll start off by introducing the panel and inviting them to chat for a bit. And hopefully we'll have plenty of time for questions at the end. So put them in the chat as we go along if you like, or we can open up the mics at the end. So what do we mean by health information literacy, and are now libraries health literate organisations? How is our role as library professionals evolving in this space? And how can we help our communities navigate the torrent of information flowing through the internet? So we're fortunate to have two wonderful panelists today. So first up will be Peter Murgatroyd. Peter is Library and Knowledge Services Manager at the Whatu Ora, Kaupū's Manukau, formerly County's Manukau District Health Board. His team supports evidence-based care and evidence-informed decision-making by providing library and research services for the staff at the Whatu Ora, Kaupū's Manukau. Peter believes in the power of shared knowledge to transform lives and communities. Kia ora, Peter.
Kia ora.
And we're also joined by Jo Cocker. Jo is Digital Literacy Specialist here in Connected Communities Department at Auckland Council. Jo's focus is on creating a more digitally equitable tamaki makaurau by increasing digital literacy and helping to identify and remove the barriers to digital access and participation, leading to a more inclusive and prosperous Auckland. Kia ora, Jo.
Kia ora, thanks for that.
So Peter, I wonder if you might kick us off then by, could you take us through talking about what health literacy means and how those of us who don't work in the health sector might support it?
Great, thank you, Philip. And firstly, I'd just like to thank Philip and the team for facilitating and setting this session up. It's something I care deeply about in terms of the role that community and public libraries in particular, but also school libraries and other libraries can play to support the well-being of our communities, and to look at the linkages that we can sort of leverage the knowledge from, say, the health sector to support the community and school sector and having more knowledge and confidence on how actually what they can do and what the tools and resources that they can use and point people towards. And I think Jo will talk about some of the competencies and skills and things which should underpin the way that you interact with your library users. So I'll sort of kick off. I'm going to keep it quite simple. I think Jo's got some really good sort of conceptual stuff that she's going to share. I think we'll have plenty of time at the end of the session so people can share their own reflections, share their own experiences, and also ask questions. And I think that'll be a really important part of today. So I'll just sort of share quite quickly how I view things from a health sector perspective, I guess, and what I would like to encourage people to think about. Right, I'm assuming now you can see my screen.
No, unfortunately not yet. Sorry, Peter.
I will, hang on, I will just, yeah, I'll try it again. And here we go.
Yeah, that's the one. Thank you.
And I'll just get it from the, get this minimized. Right, that's the homepage. You can see?
Yeah, navigating the health information landscape.
Great, great. I don't want to get 10 minutes down and find out you haven't been seeing a thing. That's marvelous. So I'll be really having a look at hopefully something that you'll be able to have a takeaway as something practical that will guide you in this space. It is a complex space, and some of us don't have confidence to think, bit nervous. It's like advising someone about something like law same sort of problem. It can be a bit daunting, and you can be a bit nervous about where to start and how to approach it. Health literacy, as defined by the Ministry of Health, and the terms and references I'll be using are very much the way that's used by the Ministry of Health or the World Health Organization, and these are accepted ways of talking about health literacy. Health literacy is being able to find, interpret, and use information to make effective decisions for health and well-being. And I think the key thing there is well-being. Many of the people in the community libraries and school libraries will think, well, health is very much the domain of doctors and nurses and social workers. I'm not either of those things, so I'm a bit nervous. But when you expand that to think of well-being, well, well-being is the core business of libraries. I mean, you could say health is too, but well-being definitely is. And health literacy is supported by clear and easy ways of communicating from the nurse, from the GP, from the hospital, providing the right information in the right way that's accessible and engaging, so that the actual person doesn't have to be an expert. It'll be easy for them to understand the things they need to understand to empower themselves to be in charge of their own health. And often we talk about in an individual their health literacy, and we put the focus on the individual. You know, you're not well educated, you have English as a second language, all these things which are about someone's sort of deficit. And there is a component of thinking about what skills and knowledge someone needs to be able to sort of understand and navigate their health. And they're important, and it's not just about education and language, it's about motivation, and it can be the time, and it can be the emotional capacity to actually deal with something which can be confronting. There's all sorts of things that go into someone's ability to actually understand and manage and take action around their health. I guess in the community library space, when someone is looking for health information, it's often at a time of stress. It could be in relation to something which is confronting them. It could be in relation to something, a life change, which is new and uncertain, and they can be challenging things, such as, you know, the worst things we can think of is someone suddenly gets a cancer diagnosis for themselves or a loved one, and that's extraordinarily confronting. Or it could be simply a life change, that someone's about to have their first child and they're trying to find out about information that will guide them to be a new parent or to understand things with their baby. So it can be things which are perfectly part of our life cycle, and things which can be exciting and very positive, and they can be things which are very confronting and very distressing. So in the community space, you'll get a wide range of people coming with a wide range of needs, and you have to be sensitive to those. But really the thing is just be able to support them to go to the places that will assist them to understand their own health situation, and it may be a referral. It may be the best thing you can do is not to try to respond, but to actually refer someone to a nurse or a doctor or a social worker. But in many instances, people are looking for information that will help them understand. Most people, before they go to a GP, and I'd imagine amongst this sort of virtual room that we're in, and we're all similar, before we go to the GP, we'll probably go onto Google first and have a little look for symptoms and things which may be wrong with us before we go to the GP. And that's what most of us do now. So people will come into the library space looking for things online. They may be looking for books and resources on the shelves to help them understand better what's happening in their health and in their life. But that's the sort of the individual aspect. When we look at a health literacy environment, we're often looking at the sort of structural things that make it hard for people. And a lot of things do make it hard for people. Things which are written in jargon, things which are written for people who don't have a university degree in some sort of health-related field. Processes which are inordinately difficult to understand and follow. The fact that we've got 10, 20 different agencies which may all support different aspects of someone's health. We've kind of got a very complex, confusing environment whereby I think the default and the norm is for people to be a little bit overwhelmed and confused when something comes along that actually impacts on their health. It's not easy, and the environment can actually be very, very challenging. So the question for us is when we look at our libraries, are we organizations that are health literate? Do we make it easy for people? If someone has a health information need, are we making it easier or are we making it harder? Are we being helpful or not helpful? Are we guiding someone, supporting someone that's going to be useful to them, or are we either leaving them alone or sending them in directions which maybe aren't that helpful? Are we ourselves an organization that is assisting someone and making it easier for them to navigate and to understand information that's appropriate for their own needs? And I think the libraries have a real potentially important role to have a greater role in that than they possibly currently are. If they see themselves as part of that environment, if you say, gee, the hospital system is so complex, I have a GP and he only gives me, or she only gives me 5 minutes. I got my letter from the specialist. I couldn't understand a word of it. There's a whole lot of things which say, gosh, there's a whole lot of milestones and signposts that can make life very, very difficult for people. And we as a library have to think, well, we're not trying to solve those other issues, but in the things that we do control and we have influence over, are we making things easier and more helpful for people who are looking for health information? And I think that's the key question. We don't have to go too far. We just think, what things are in our control and our influence that we can actually make things a little bit easier for people. The community libraries are trusted sources of information. And we shouldn't lose the fact that actually people trust us. They trust the information that we direct them towards. And so we have a very potentially important role to play to be of support to people in their health and well-being needs. There are all sorts of reasons why it's a natural fit for community libraries and school libraries in particular to see themselves as, I guess, well-being hubs, health hubs for their communities so that people's well-being can be supported. And indeed, when you look at the COVID response, you know, the government gave us as a sector over $58 million as part of the COVID response because they saw our role in community well-being as absolutely critical at a time of national, I guess, distress. So the government, in terms of giving us that money to sort of support our library services, saw that actually we are a key part of supporting the well-being of our communities. And I hope that I guess you know, the people in this webinar who've come are really excited about that and think, well, actually, how can I do more? How can I grow my confidence in that area? Many of us are fully aware, you know, of the misinformation and the disinformation that has really plagued the COVID response, but it actually applies to all sorts of things. There are, you know, fad diets and fad solutions to this and that and the next thing, and people can get very confused over, well, which information should I trust? And as a library professional, and so I said, well, what's the best source of information? So, you know, a natural response could be, well, actually, there's lots and lots of sources, and you have to critically evaluate each one, and you have to work out if they're current, and whether they're relevant to you, and who published it, and whether we can trust it. And there's all sorts of things which make it very hard to say, actually, here is the place that you can go, and here is the place that you can trust. And it may be for those reasons that people are a bit nervous about entering that conversation about really delicate subjects that can be, as I say, a life experience subject, such as something like grief, or it could be something like puberty, or it could be a relation to a wellness issue, such as, you know, pre-diabetes and exercise and nutrition. They're pretty complex and delicate topics. And you think, well, gosh, where do I start? Well, I guess what I'm trying to give you in this session is a place to start that is rock solid, gold-plated, entirely trustworthy, that effectively is a one-stop shop where if someone says, in New Zealand, where do I go to for trusted health information to support my understanding of my condition, to support my well-being and growth, whether it be physical or mental or developmental stages, that place is Health Navigator. Now, the screen that you see in front of you now is the new screen for the new Te Whatu order, which combines what were 20 district health boards. And so that's the homepage for every hospital in the country and every clinician in the health sector. And on centerpiece of that website is saying, if you are looking for consumer health information, you go to Health Navigator. It took us a little while, I guess, to get to the point where it was mainstreamed and embedded within the health sector. It started off very much on the side as a project, the Health Navigator project, but now it's seen and recognized as the most reliable, most relevant, most contextually engaging and appropriate place to point people for health information in New Zealand. This is what the site looks like. It's healthnavigator.org.New Zealand. The key things are about it, unlike the Ministry of Health site or the World Health Organization site, it is designed and built to engage. It is multimedia, it has color, it has videos, it has real people talking about their real experiences. It's designed, I think, for someone with a year 8 education, so it doesn't assume that someone has an advanced level of education. And where possible, resources are published in multiple languages to reflect our diverse community. We often talk about, and I think Jo may talk about, some of these issues around digital access and digital literacy. And I actually wasn't aware of this until I started putting this presentation together, that actually you can access the site without data using the Spark, Skinny, Vodafone and 2 Degrees networks. So if someone has a phone but they don't have any data, they can actually access Health Navigator and the information on it without data, which is a really a great concept. It's probably one of those things that is largely unknown, that people haven't tried. I'd be interested in the stats to see how many people are actually using it that way. But I think the fact that they've created that foundation opens up a huge potential in terms of addressing issues around the digital divide. The site, briefly, and I'll try not to take too much time so that Jo can explore some of those really exciting issues that she's going to explore, is it's sort of multi-layered. You can look for an individual condition, and obviously the one that you would think of as something like COVID. What information does it have around COVID? So it has all sorts of information when it's, it can be clinical, it can be lifestyle, it can be procedural. How do you do this? How do you get a test? What's the issue with rat tests and things? And it can be quite specific to symptoms and how to treat symptoms. So it can be something you would go to for any particular illness or condition, and it has very current, very detailed, very accurate, but also very engaging information. It also, and here's another example, type 2 diabetes. So someone's looking for information on type 2 diabetes, and you'd point them in the direction of Health Navigator. They'd be able to search or drop down the menus and find it. And again, it will include all the resources and pamphlets and reports from the main agencies in New Zealand, such as if the Heart Foundation or the Cancer Society have a report or a publication or a guidance around those illnesses, that will be available through Health Navigator. You don't have to jump off and look at the Cancer Society or the Health Foundation or the Mental Health Foundation. All their resources are accessible and available as part of the resource set of Health Navigator. It brings everything together. It also has lifestyle stuff. So if you're talking about mental health issues or how to improve your fitness or your diet, or you have an issue around drinking or addiction, some of these sort of lifestyle and behavioral things, you can browse resources and see videos of real people talking about their real challenges and how they've addressed some of these issues in their lives. So it's not only conditions and illnesses and sicknesses, it's also about how to live healthier in the broadest possible sense. It also has an app library. So often you think, well, there's a lot of health and well-being apps. They're not all trustworthy. Some of them have some real gaps in terms of securing your information, and there's privacy issues. And so it's a bit of a lottery and a dangerous thing to sort of go online and Google different apps and download them to your phone and start using them. There's a lot of fish hooks and pitfalls to that. And so the team at Health Navigator, and there is a team of very skilled, experienced both clinicians and people who are active in the digital health space, who review all apps before they promote them on the site. So anything which is on the site, and it doesn't have thousands, it has a much, much smaller number, have all been reviewed from a clinician in terms of their clinical accuracy, but also from a digital security and data aspect. So we've made best efforts to ensure that people aren't putting in personal confidential information that can then be used by a third party. So the app library is a small but growing and key part of the resources that you get pointed to. In terms of, I guess, not just take my word for it, but if you go to the site, you'll see that health clinicians, academic professionals, former Pilson Library Manager at Auckland University, Megan Clark, who was part of the Health Navigator team in its inception, will put their name and their endorsement behind both the value of the site, but also the clinical accuracy and reliability. So it has complete endorsement from the health sector, complete endorsement from the academic health sector. And as hopefully you saw by the screens, it's designed to be accessible and to be engaging. In terms of after this session, if you think, gosh, I really want to get into health literacy and become a health literacy champion in my library, Health Navigator also has a really nice collection of resources around health literacy, which you can actually use as your sort of touch points to understand some of the issues and sort of to grow your confidence and competence in that area. If you want to promote Health Navigator, you can contact Janine Bycroft, who's the chair of the Health Navigator Trust, is a very, very well-established and respected general practitioner. And there are posters, there are cards, there are all sorts of different resources that you can use to promote Health Navigator to your customers. But the thing which, and this is, I guess, a challenge, many libraries don't see it as part of their scope to provide an access link on the websites to resources that they do not own or subscribe to. So a library site will only have the databases or the resources that are subscribed to by that library. I would argue and push that in this instance, given the role of libraries to support well-being, all community libraries and all school libraries should have a prominent link on their sites to promote access to this resource as part of their core goal to support health and well-being in the community. Some libraries do, and community libraries do around New Zealand, but only very few. And I think that's a challenge. And I'd be interested in the response to that challenge in the discussion at the end of myself and Jo's talk. So at that point, I'll sign off, throw over to Philip and Jo for the next part. And I look forward to some questions and maybe some responses and be challenged myself. I love that at the end of the session.
Thank you very much, Peter. I love the way you talked about libraries being wellbeing organisations and how we might support access. Anna Pickering is often in Europe at the moment after the Willock conference, and I saw she posted a photo of a library she's in that had a GUI guide of GUI numbers for sensitive subjects, so things that customers might not be comfortable asking for the GUI number on. So I think it's a very good example of some of that work. Right, over to Jo now. So Jo, could you talk to us about digital equity and the shift we're seeing towards digital health, perhaps?
I can, yes. So I'm just going to, I guess, follow on from Peter and put a bit more of a library lens over that with some examples and just a bit of context. I'm conscious at the moment that we're very busy in our libraries across the country. I know a lot of libraries have lost their NZLPP funded staff, or those staff have gone back into their home roles, and with the different post-pandemic, should I say, issues that are affecting our society, I know that we're a little bit under the pump across the country in our sector. So this is by no means asking people to start doing more and feel more pressure, but it's more about that kind of future focus and how as we as a profession evolve into this space, and how can we maybe add a health literacy lens to the work that we already do. As Peter said, well-being is kind of our core, and I say that we are the heart of the community. We're the beating heart for information, if you like, and I think people move through libraries, they pick up information and they take it back out into the community and they share and distribute it, much like the blood vessels through a body. So that's kind of the analogy I have in my head for libraries. So I'm just going to quickly share my screen. I'll try anyway. I have a wee presentation. So let's see how this works. Can everybody see that?
Yep, thank you.
I'll minimize myself. There we go. Okay, awesome. So I just want to start off. So I don't know how to get rid of this. The irony. Does anyone know how to get rid of that? No, I might leave it.
Don't know what you're trying to get rid of. I can't. We can
Oh,
only
the
see the
bar,
slide.
the bar at the top. It's just my bar at the top. It's just, yeah, it's okay. No worries. So I'll just start off with the digital equity, digital literacy, digital fluency kind of definitions. So when we're talking about health literacy and digital health literacy, I think it's important to just look at how that sits within the wider digital equity conversation. So just a little definition there about what digital equity is. Digital equity being the condition in which all individuals and communities have that access to information technology, but also the capacity and the skills to use that technology to fully participate. And that's, whether it's in our day-to-day lives, in democratically or economically, and that it is vital, it's essential for civic and cultural participation in many areas of 21st century life for everybody, and this is increasingly becoming so. And I'll show how that reflects in the health sector shortly. So then when we think about, we too often talk about digital literacy, and I think digital literacy is one component, but I like to think of this as a spectrum. So you've got digital literacy, digital fluency, and digital citizenship. So if equity is about equitable access, once you've got the access, how are you able to function within that digital space? So literacy is like your basics. So if we use the analogy or the metaphor of learning to drive, so digital literacy is, you start to understand what a car is, how the car works, you get in the car, you start messing about with the pedals and the levers, and you might, trundle down the road a little bit, and you start to understand the basics around what it means to drive the car and be on the road. And then digital fluency is when you've moved beyond that step, you've kind of, you've moved from your learners to your restricted, you're feeling pretty confident, you're starting to drive without thinking about it, and you have got a greater understanding about your space and place, and how what you're doing reflects that. And then digital citizenship is kind of, you've got your full license. You can drive any car, whether it's automatic or stick. You can drive on any side of the road in any country. You know the rules. You can, get, upgrade and do whatever, and you're fully confident, and you're also able to teach others. I think, digital citizenship is where, you're just functioning, a new technology comes down the road, and you're able to just pick it up and adapt with it. A lot of our conversations focus on digital literacy, and I really think we need to start to be looking wider about what happens beyond that, especially in the health sector, because what we're seeing is smart technologies moving into the health sector. And what people are not realizing is that, in the next 5 to 10, 15 years, a lot of how we manage our health will be through technology and smart technology and what's known as the Internet of Things. And if we don't digitally prepare people for that now, we're going to have an even bigger divide in another decade. I'll just move on. This is just a little diagram then that shows how digital literacy and access impacts on those other areas of life that I mentioned. So you can see the healthcare system there, and we're talking about, wearable sensors, health coverage, telehealth, patient portals, and health apps, which are all things that Peter was alluding to in his presentation. So why does digital equity matter? Digital equity matters to us, I think, and to local government, because we're moving a lot of our services online. And the recent CAB report, some of you might have seen the parliamentary debate on the CAB report last week, found that when they recorded over 3 months, 4,379 client interactions had digital exclusion as a key issue as to why they were there. So it really identifies, this is a huge area of impact. And the census itself also highlighted the challenges of moving to a digital first model without putting a digital equity lens on the work that you're doing. A lot of people didn't participate in 2018 because they weren't digitally enabled. And then we're also seeing the increase in digital enablement strategies, not just in health, but across many sectors. So we have an accountability for ensuring no one is left behind. Oh, sorry. Further, this is the further impacts, just I guess from the grassroots level, from the experiences of people on the ground. If people aren't able to digitally participate in their health and other areas of their life, then they're unable to learn. They're excluded. They feel forgotten. It increases that stress and that struggle, which is something that Peter talked about, not having that information, and it's disempowering. There's a sense of whakama and shame, and they start to feel frustrated and overwhelmed. So it all becomes very compounding. So if you think about someone who has got a cancer diagnosis or a relative battling diabetes or early dementia, and they're already in a vulnerable position, not being able to have access to that information is going to make that situation even worse, and not have access to the support they are entitled to. And then there's some quotes there from people around, the real impact on the ground of not having technology, not feeling relevant or being able to participate. So the shift towards digital health. I'll share this presentation. There's a lot of research in there. I joke that I am a librarian by trade, so I will always give you information. There's some links here to digital enablement and the digital health strategies of the New Zealand Health Service, of the Ministry of Health. The Ministry of Health has a digital health strategy and how it's transforming its services into the digital space. And as part of that strategy, they have a digital enablement fund, which they're using to fund various projects across the country. And I've put a few in here, which will kind of highlight and illustrate the points. These are all apps, which again, Peter was talking about apps. So, enabling people to have access to a smartphone is one thing, but the safety and security and the skills required to navigate those apps is essential. The Ministry of Health is also launching a new project, which is the transfer of health information into electronic formats through something called MyHera. So MyHera is going to be a way for everybody to access their health information, for it to be shared with their health services as well, their health providers. So talking to the Ministry of Health about that and the role of libraries in making sure people are digitally skilled to participate. Doctor's appointments and services. Some of you may be aware of something called My Indice. I know my doctor has shifted to that, and that's where if I want to make an appointment now, I go online. I do it with my dentist. If they want to contact me and send me some information or a message, they'll message me through the portal, and I've got to go online to access it. Digital health support services, so a lot of support moving online as well. And then you've also got the growth of telehealth. And then finally, around the issues of Maori data sovereignty. So Maori data sovereignty is really tied to Article 2 of the treaty, and talks about the right to have sovereignty over sovereignty over land. But it's now been used to talk about the right of sovereignty in the virtual space, not just the physical space. And how do we enable Maori to be digitally enabled to battle, I guess, what people would call colonization within the digital space. And there's an AUT project currently being funded around digital literacy and how that can improve Maori health outcomes. So again, I'll share that with you, and you can pop through those links and have a look. So how can we help? Well, it's estimated 1 in 5 people in New Zealand lack at least one of the 4 elements to be digitally included. And some of you may be aware of this. It's motivation, access, skills, and trust. And this, again, Peter touched on a lot of this when it comes to how people access health information, whether they are motivated to access health information, whether they have access to it, whether they've got the skills to understand it, and then whether it's can be trusted. So those digital literacy skills that we teach people around these areas and the digital equity issues around these areas are very much transferable into the health literacy space as well. So by helping people see the relevance, understanding awareness, working with our community partners and our community health providers to help raise awareness, providing that access, supporting the skills, and then working on that information literacy angle can really help. So, effective participation in life, work, and society involves one's ability to navigate the digital realm and use these technologies. So we can also support through equitable access, the development of skills, acknowledging that we have some accountability as we digitally transform our services and bring people along on that journey, and that this requires joint leadership for a unified digital public service. I don't think this sits on one department's shoulders or one ministry's shoulders. This is something we should all be working to collectively on, centrally and locally. So this is just some examples of health literacy and public libraries. You may be asking, well, how do we as librarians fit within this? So there's some examples that you can pop into at your leisure later on. Queensland in Australia works with their Digital Health Australian Digital Health Agency and the Australian Library and Information Association to fund a training program for public libraries and Indigenous Knowledge Centre staff, where they trained their staff to provide digital health literacy support. So they didn't just say, this is something you should be doing and draw on the skills you've already got, but they trained them specifically on what it meant to support people in this space. And I think that's really something that would be good for us to look at in this country as well, and maybe to speak to the Ministry of Health about. The Victoria in Australia had the Libraries Change Lives campaign, which I just love that phrase. I think it's amazing. I wish we could steal it. And they launched their health and wellbeing framework, and there's some links there, which again talks about our role in wellbeing and for supporting wellbeing in our communities and that place of knowledge and connection. The USA has a lot of examples of how their public library sector works in this space. There are various people bringing healthcare and digital equity together. So there's a link there to some examples from different states. And then in the UK, they spent 5 years working on a library task force that worked with government to show how libraries could support different sectors and different parts of public service. And one of the things that came out of that was a health and digital literacy partnership between the NHS and public libraries. And there are, I think, about 9 pilots running in the UK at the moment. So again, worth looking at. And then not to leave us behind, here in Aotearoa, you may be aware, you will be aware most likely of Rotorua's Children's Health Service Hub to Akamari, which is positioned and situated within Rotorua Library, and enables young families and young mums and dads to access health advice and support for their children and around breastfeeding and literacy, children's literacy, just general health inquiries and those kind of things as well. So, and that's on site. So is it blue sky thinking? I don't think it is. You've just seen a lot of examples there. I'll let you again unpick them at your leisure. Telehealth in libraries, I think, is one quick win that we could do in this country through the use of health pods. So in Delaware in America and in Pottsboro in America, they both have, Delaware has device lending as well as telehealth kiosks, so enabling people to take a device home to access health information, but also on site they have safe spaces that people can go into that's soundproofed, where they can access devices to have Zoom appointments, health appointments with a specialist, etc., and also find information in privacy. So the University of Canterbury Centre for Entrepreneurship did a short presentation pilot. They won an award for the idea of health pods in the community, and they talked specifically about libraries being one of those locations that we could use. And then virtual care stations in the community, and this is out of Amsterdam, and it's from Philips Technology. And again, it's the same premise, and there are other providers of health pods as well. So that, this is a quick win thing that we could do where we provide that space and access. A health navigator could be on a device, on a laptop, or a fixed unit in a pod, and people could go in and have some privacy while they research their health, and then also use that to talk to their specialists or doctors as well. So again, you might be saying, why me? Why libraries? Do we not do enough? What can we do more? And it is about building partnerships, but also about valuing our expertise. We are not medical experts, but we are information professionals, and I stand by that. And we can work strategically with partners in the community to support people to get better access to health information. And we can do that by supporting access to trusted information sources, such as Health Navigator. We can do it by helping to develop those basic literacy and digital literacy skills to empower people to understand and navigate those information spaces. We can connect to community and government services, respond to local need at a micro level. This isn't a one-size-fits-all approach. We can support community-led solutions, work with our communities and those organisations on the ground to help build support and capacity. And we can also collaborate for collective action. When we talk about basic digital literacy skills supporting digital health literacy, we can also be doing this, doing something now by running digital literacy classes that will empower people with the skills to then navigate online health resources, so helping them understand how to manage and set up email, use online chat, basic information literacy skills around trusted resources, and then internet safety and keeping yourself safe online. These are all things I know a lot of us do already. The DIAA does a Stepping Up program, which I'm sure many of you are aware, and these are ready to teach digital literacy classes that you can download and deliver, and then use their Arlo system to promote to your communities. And they're running free staff training on this for the next 12 weeks from the 24th of August. If anybody is interested in signing up or putting their staff through the training, I would highly recommend it. So yeah, that's my presentation. That's kind of a whirlwind tour on why libraries have a role and a responsibility and what we can do. And I hope that was useful. I will share.
Thank you very much, Jo. Great information there. Yeah, it's really interesting hearing both of you talk about those masked aspects and how they can restrict people's access. Okay, let's open up to some questions then. So I don't know whether everyone would be able to open their mic or not, Angie, but yeah, if not, post in your chat. I'm sure people have got questions, far away.
I've got one, if you can hear me, Philip.
Kia ora, Stacey, yep.
Yeah, kia ora. It's interesting kind of listening to people, and especially when Peter was talking at the beginning, I was thinking about a situation I kind of found myself in when I didn't work in a public library. I worked in a special library, and I was used to all kinds of different information queries. But one day a partner came to me and asked me to find some information about what was the best cancer treatment for his wife, who had just been diagnosed with a very serious cancer. And I have to say, that's probably the scariest question I ever received. And I was just kind of wondering, I guess, why is it that it really does? We are information professionals. I'm used to finding all different kinds of information, but it's interesting. Health information can be a bit scary, and I wondered if either Jo or Peter had any insights into why that area is so can be so touchy for us.
I think, Stacey, your natural hesitation is the right approach. If someone came to that question, it would be potentially dangerous for a non-health professional to begin to answer that question. We would get a question in the health sector, for example, what are the latest range of treatments in a particular area, and provide the evidence to support new guidelines and new areas of treatment in the hospital. And that would then be given to a clinician, a nurse, a doctor, or allied health professional, and they would determine the answer to that question: what is the most appropriate form of treatment? You would be very, very reluctant to take that on as a community librarian or a school librarian, or even a librarian who didn't have a health medical training and background, because it is dangerous. So I think your natural reluctance or fear is actually the right response, because it is a very, very delicate and potentially dangerous situation to give someone the wrong advice, which is why I guess when I was pointing people to Health Navigator, it doesn't try, you don't get in the position of having to answer those questions. And so part of the response is to reframe someone's request to you and outlining, well, I can point you to some great sources, and that could be a Health Navigator around cancer, but it may be in terms of, I think Jo talked around your role in the community as being a sort of a network link, and actually probably the best place to go to is, are you a member, do you have a local GP, or you actually refer someone on to the right place to ask that question. So I think your natural fear and hesitation, to me, is exactly the right approach, because it's extremely dangerous to give someone the wrong detailed advice.
Yeah, I just add on that. I think the other thing is, we're talking about information, linking them to information, but also linking them to organizations. So, there are the Cancer Society and, other organizations for different illnesses. And I think, encouraging someone to reach out to a professional body, a nationally recognized professional body, would also be something to help alleviate some of that concern. Because I think, and, and just, again, to be aware, I think, understanding that for staff it can be difficult. They might have had a cancer diagnosis in their family, it might be triggering, and just understanding that there's a need for that kind of empathy and support as well. But it is our role to provide information and to maintain a professionality around that. So yeah, I think also thinking about those, I did it when we used to get work enquiries, from people. And I'd say, well, there are professional bodies for every profession. Speak to those organizations and they'll be able to connect you locally to people who can support you and that kind of thing. So yeah, that might help as well.
Thanks, Jo. Who else? I have a question for the audience while we're waiting for the next person. I'd be interested to hear what anyone might be doing out there to support health literacy or access to health information in their libraries and workplaces. I don't know, Jo or Stacey, whether you remember, I think we had something like health information prescription or books prescription, something like that we did in Auckland once.
We did, Peter and I, actually, I don't know if he remembers, about 5 years ago, tried to resurrect the health prescription. And then we failed. We didn't fail, but I think there was a multitude of priorities that took precedence. But yeah, we did used to do books on prescription and that kind of thing. Yeah, which has been done in the UK as well.
One of the questions I'd have for the audience, and I don't know the answer, but the way that I see it, that health and well-being is part of everybody's role in the library space in terms of people that come in looking for health information. So it's a core part of what you do in the same way that, providing access to the internet and supporting reading and all that sort of core roles. But as we sort of alluded to, it can be a little bit daunting, a little bit overwhelming on how to be, to be on top of all the aspects, particularly those that Jo talked about. And what I would say is that I would think there's potential for each community library space, whether it be at a sort of a branch level or a district level, if it's a smaller district, to say, actually, we're going to identify within our team a health and wellbeing champion. And it would be their role and be given staff time to grow their confidence and knowledge and to be a leader in that space to share and guide the other members of the team. And part of their role would also to be aware of the different community connections, the district nurses, the GPs, the health clinics, and so that they can actually lead the sort of the outreach. So making your library space available to different trusted sources to hold events. Could be around, obviously COVID was one of those events where you work in partnership with your community partners. But I would think there's potential within most sort of branches or districts to say, actually, we're going to identify someone and acknowledge them and give them some time and some training and some support, and they will be our health and wellbeing lead. And they will have a role to actually support and guide other staff members in that space. Because when it's everybody's business, it's nobody's business. And I think there's a place to say, actually, this is a defined role that has a real value, and we can recognize it and give people training and support. What do people think about that idea?
I love it.
I think it's interesting when you reframe it to be well-being, how much less scary it is.
Yeah, I like the idea. I think my only concern is that when we tried it with digital, didn't we, Philip? When you create a digital champion, people will naturally just defer, and everyone else is too busy. And if that person's not in on a certain day, then you can't get the information that you want. So I think I like it in principle, but there'd need to be some work done to make sure it didn't all sit on that person's shoulders. But yeah. I mean, there's some great. Unfortunately, I shared my presentation in not in PowerPoint, as a PDF, so I couldn't click through. Honestly, I don't know how I got the role as digital literacy specialist some days, but I couldn't click through. But to my links, which is what I plan to do for some of them. But there's some really good stuff in there. I think that to help people think about it in a library context and what it means to operate with providers. There's the phono, there's I'm sure across the country, different community organisations that work in different areas of health and well-being. Strengthen partnerships with them. Go and speak to them about what can libraries do to support their community's access to health information. There are events that we can run, the sessions we can run. Are they connected to a cohort of people, maybe a diabetes group, who have low level of literacy and digital literacy skills that we could then work with in a bespoke way to upskill them with digital literacy skills so they can better manage their diabetes? Because I know a lot of that is going online for self-management. So there's different ways that we can do this. It's not about sitting there waiting for the community to come and ask us these questions. It's about being proactive around how we can support the community's health and well-being with those existing professionals who are already out there in the community.
Thank you, Jo. Right. Give it a few seconds to see if there's any last questions. No, maybe not. Okay. So Jo, you'll post your slides on LIANZA Keep. We might see about if we can email them out to people as well. But probably, it's probably a great place to continue the conversation if anyone has any other questions. And what's Megan got? Libraries to help. Yeah, great, Megan. Yeah, and if anyone does have work that they're doing in the space, then yeah, share it on LIANZA Connect. Yeah, really good to keep the conversation going there. So thank you very much, Peter and Jo. Yeah, great conversation. I've learned a great deal, and there's certainly some actions I'm going to take out of this. Checking whether Health Navigator is on our website and on our bookmarks on the public PCs have been one of them. So I'll wrap us up with a karakia. Me karakia tātou. Kia tau nā manaakitanga I te mea nāro. Ki runga ki tēnā o tātou. Kia mahi te hua ma kihi. Kia toi te pupu, toi te mana, toi te reo araha. Toi te araha, toi te reo Māori. Kia tūturu, ka whakamaua kia tēnā. Hui e, tae ki e. Thank you very much, everyone.
Ka kite.
Thank you, ka kite.